Today, we will share with you one of the applied practices of psychology which focuses on treating a person's maladaptive cognition, emotion, and behavior with the use of different approaches. But first, make sure to like this video and click subscribe and hit on the bell button so you can get notified whenever we release new YouTube video. We are also on Facebook, so make sure to like and see first at facebook.com/LahokTC. This is Donnies Bendicio, and welcome to the series of Lahok Training Center's approaches to psychotherapy. The following are the major approaches being used by psychotherapists to solve a person's psychological disturbance. These major types of psychotherapy are likely derived from the theories of personality, and some are likely originated from philosophical perspectives. We have a therapy that focuses on childhood experiences and traumatic experiences, that is psychoanalytic and psychodynamic. We also have approaches which are focusing on cognitive and behavioral modification. There are also approaches which are originated from philosophical perspectives that try to promote well being, self actualization, such as humanistic and existential approaches. And lastly, there are psychotherapists who try to modify and integrate these approaches depending on the needs of the client. First, let us discuss psychodynamic approaches. Psychodynamic approaches are one of the earliest practices of psychotherapy since Sigmund Freud's psychoanalysis. These approaches are more focused on identifying the client's repressed early childhood experiences, attachment styles, which likely affect the way he or she behaves, relates with other people, and perceives things in various situations. Psychodynamic approaches tend to use several techniques to explore the unconscious motives, patterns of behaviors, by means of interpreting the meaning of symbols inside one's dream, the slip of the tongue, the transference of emotions, and the like. The psychodynamic approaches evolved from Freud's psychoanalytic theory and therapy. So, these psychodynamic approaches are products being developed by Freud's followers. There are psychologists and thinkers who influenced the development of psychodynamic approaches. We have Anna Freud. Anna Freud continued Sigmund Freud's work by specializing psychoanalysis to children. She also extended her father's work on defense mechanisms. We have Carl Abraham. He investigated the purpose of infant sexuality in personality development and mental disorder. Karen Horney proposed that neurotic trends such as detached, aggressive, and compliant types are likely resulted from persons' basic anxiety caused by early childhood experiences and interpersonal relationships. We also have Carl Jung. He established analytical psychology, which focuses on unifying the conscious mind with the personal and collective unconscious. We have Eric Erikson. He proposed a theory on persons' psychosocial stages of development. He coined this term identity crisis. John Bowlby and Mary Ainsworth proposed that a child's survival depends on attachment behavior, which has been biologically determined. And also, we have Melanie Klein. She proposed uh, play therapy, which focuses on a role of mother and child interpersonal relationships in the child's development. Okay, so generally, the unresolved problems back in our childhood believed to be influencing the way we behave in our adult life. We have different approaches such as dream analysis, free association, and analysis of the transference. Dream analysis is focusing on analyzing of the symbols in one's dreams. On the other hand, free association tends to analyze the things that the client is saying, that comes to mind, which are associated with the words given by the therapist. We also have the psychodynamic or the psychoanalytic approach may also include the analysis of the slip of the tongue or the Freudian slips. Even the client's jokes and humor are being examined and interpreted. The transference, on the other hand, is the analysis of the transfer of negative feelings and emotions from one person to another. For example, we have the negative feelings for the parents. It is being transferred to spouse, or the therapist, which are brought during the psychotherapeutic sessions and many others. Now, there are clients of the psychodynamic approach may include individuals who are suffering from issues of relationship with the immediate family. Now, symptoms of depression, emotional conflicts, emotional wounds, and the like are likely served by the psychodynamic approaches. Next one, we have cognitive and behavioral approaches. Cognitive behavioral approaches are focusing on modifying the client's maladaptive thinking, which likely affects the way he or she perceives and behaves with the situations. Now, the behavioral part of this approach focuses on the learning role in developing both normal and abnormal behaviors. On the other hand, the cognitive part of this therapy emphasizes on what that person thinks rather than what they do. Now, there are following psychologists and thinkers who influence the evolution of cognitive behavioral approaches. We have Ivan Pavlov. Ivan Pavlov delivered relevant participation to behavioral therapy by identifying classical conditioning. In his perspective, he tended to approach this desensitizing. Now, desensitizing is the therapist's approach to help the client with the phobia by repeated exposure to the causes of the anxiety. We have E.L. Thorndike, who proposed this discovery of operant conditioning, which tends to rely on learning based on punishment and reward to modify the behavior of the person. We also have CBT proponent Aaron Beck. He identified the mechanisms that are relatively responsible with the symptoms of depression. He identified the cognitive triad. The cognitive triad tends to identify or refers to person's negative thoughts about the self, negative thoughts about the world and the future. Now we have the negative self schemas. Negative self schemas is a set of expectations and beliefs of themselves or the client's perspective, which are generally pessimistic. We also have cognitive distortions, which are illogical and distorted thought processes that likely result in symptoms of anxiety and depression. We have Albert Ellis, who proposed the REBT or Rational Emotive Behavior Therapy. This model resolved a person's maladaptive thinking and emotion and behavior patterns. Okay? One of the most applied approaches, as we have said, is the cognitive behavioral therapy, which focuses on a short-term program of psychotherapy aiming to solve the concern and distorted thinking of the individual, which likely affect the emotions and behaviors due to a stressful environment. This approach is focusing on problem solving and eventually modifying the person's thoughts and behaviors to problematic circumstances. Now, CBT is suggested to be responsive with the symptoms of anxiety, depressive disorders, and marital difficulties. CBT also is effective as an intervention to pain disorders that are associated with the stress. Now, most of the time, client will who are undergoing CBT receive homework and exercises to learn the skills in solving maladaptive thinking pattern and its effect to clients' emotions and behaviors. Now, CBT is usually conducted by a licensed specialized psychologist or a psychotherapist in cognitive behavioral therapy. In order for this therapy to be effective, the client must be comfortable with this approach, and if not, there are other types of therapy that may be considered by the client. Now we have the humanistic existential approaches. Now this approach is more focused on psychotherapists' respect, accepting, and non-intrusive approach to develop a person's capacity for full potential. Now, actualizing tendency is a very important in this process because making rational choices is more focused in this approach. Now, this approach is most likely described as in contrast with Freud's psychoanalytic perspective, which focusing on sickness, problematic behaviors, and person's sexual drive. Now, humanistic approach in this type of approach is likely influenced by psychologists such as Adler, Abraham Maslow, Carl Rogers. Carl Rogers proposed this client-centered approach or therapy, which declines the design of the therapist as the authority on client's inner experiences. Rather, the therapist help client to develop by highlighting their care, unconditional positive regard, and empathy. There are psychologists such as Eric Fromm who suggested that person's separation with the natural world gives birth to this existential needs such as relatedness, rootedness, identity, and frame of orientation, which are likely related to this humanistic side of this approach. We have Alfred Adler, who proposed that a person has a feeling of inferiority which drives him or her to strive for superiority. We have Carl Rogers again and Abraham Maslow, who believe with a self-actualizing tendency. Now, the part of existential approach directs the person for the free will or self-determination and the search for meaning. This is more focused on promoting a person's rational choices, self-awareness, accepting the anxiety is part of the human condition, and developing maximum potential rather than focusing on symptoms. Okay? Now, clients who have restrained ability with the meaning, authenticity, and self-directedness are likely benefiting from this kind of approach. Now, it aims to enhance relationships, it enhances characteristics of commitment, love, caring, and creativity, as well as acceptance of oneself. Now, there are philosophers and psychologists who likely contributed with this approach. We have Viktor Frankl, Rollo May, Irvin Yalom. Okay, we also have influences coming from Gestalt therapy such as Fritz and Laura Perls and Kurt Goldstein and Kurt Levin. Okay, now let's proceed with the last one, the integrative or holistic approaches. As you can see here, it is integrated and combined approach of the psychotherapy. So this may include several techniques integrated into procedures of the therapy. So most likely, it is identified with a variation to the psychotherapy evolving with the combined approaches. Okay. So we have discussed the major types of the psychotherapy being used by practicing psychologists and psychotherapists. We may discuss other types of psychotherapy in the near future, so make sure to like and subscribe, join our Facebook group, and like and follow us on Facebook for more updates and contents like this. Now, thank you so much, and I always hope that we will see you in the next video. And here are the other types of psychotherapy which we may discuss in the later part. Okay, so here are the references. Thank you so much, guys. If you have questions, please drop by with the questions and concerns that you have. Thank you so much, guys, and we will see you in the next video.